Good morning, Mike. In this ongoing battle against COVID-19, many have been awaiting the eligibility to bear a vaccine in their arms. It's a protection that Joe Biden says could come as early as May.
That's really our goal is, vaccines are our hope that we're going to get back to some type of normal.
Vaccines and hope have been on the horizon. ICUs haven't been as overwhelmed.
Really throughout our 3 campuses, today we have less than 60 patients in the hospital, which is so refreshing. And I think our staff are just feeling that they can take a deep breath.
And COVID cases have been going down.
When we get to a point where we don't have 100 cases a day, we're thankfully out of 1,000 cases a day.
And with vaccines and other protective measures in place,
if things go as we planned, just as the president said, by the time we get into the early summer, the 4th of July weekend, we really will have a considerable degree of normality.
But the year-long fight against COVID isn't over yet.
There's no magic end date. We don't say on, July 1, COVID is no more.
As of Monday, Assistant Division Director of Health Services at the Kern County Public Health, Kimberly Hernandez, who has been at the forefront of the vaccine rollout locally, says Kern County has enough doses to cover 8.5% of the population so far.
We know that the other interventions work. We know that masking works. We know that distancing works. That vaccination is a layer upon all of the layers we've put up to protect ourselves.
Every day, more and more people are getting vaccinated at one of Kern County's over 100 vaccine sites across community providers like pharmacies and hospitals. One of those providers, Dignity Health, planning to set up a consortium with Kaiser Permanente and Adventist by the end of March. Memorial Hospital's chief nursing officer projects mass vaccination starting at 2,000 and eventually 5,000 people a week on CSUB's campus.
So our goal is to give about 400,000 plus vaccines when we're all done. So that should really go a long way in making a dent.
Pfizer and Moderna vaccines have been administered in Kern County since December. Johnson & Johnson, Hernandez says, becoming available for order at the beginning of the month. Some doses, Public Health says, are even with community providers right now. Public Health announced that as of Monday, people ages 16 to 64 with certain health conditions, disabilities, illness, and living spaces or work environments that put them at higher risk for serious COVID-19 illness are eligible for vaccination in addition to the elderly, frontline workers, first responders, and teachers.
It probably adds another, 400,000 to 500,000 people in our community who become eligible for vaccination.
Appointments depend on how many doses get allocated to California, then to local public health on a week-to-week basis. The vaccine rollout, Hernandez says, was inconsistent at first, but has grown steadier over the last month. She adds they get administered within a week of their reception. At last week's Board of Supervisors meeting, Kern County Public Health Director Bryn Kerrigan saying that Kern County could give 1 dose to 55,000 people per week across all providers, but it's a matter of getting those doses.
That, of course, depends on vaccine production across the country and how it's being allocated to the state.
Meanwhile, Hernandez says there are still some unknowns, like new variants and likelihood of reinfection from those variants. Plus, there are still community transmissions and undetected cases.
We still need to be vigilant. We still need to take care because, we want to make sure that we don't see another surge like we saw in the winter. The winter time was a very heavy surge across the country. We felt it here in our community. And so we want to protect ourselves against that.
Hernandez encourages anyone who wants to get the vaccine to check My Turn, the public health call center, and community providers like pharmacies regularly. Public Health announces rollouts via social media as well, and Hernandez encourages people to enroll in the CDC's V-Safe program and to be in communication with your healthcare provider in case you have reactions to the vaccine. The CDC updates possible symptoms people may be getting to Public Health so they can tell the community as soon as possible. And for anyone still on the fence, Public Health encourages them to contact their call center or individual care providers with questions. In Bakersfield, Kristin Vartan, 23 ABC News, connecting you.